Ever wonder why caring for a child is so different from caring for an adult patient? That's what child health nursing is all about. Hi everyone, I am Mahima, and in today's video we will dive into a very first chapter of child health nursing, that is Introduction to Child Health Nursing and Concepts. So what is child health nursing? The word pediatrics is derived from ancient Greek, in which Pias means child and Itrios means healer. Thus, the meaning is healer of children. So the definition goes like this. Pediatrics is a branch of medical science that deals with the care of infants, children, adolescents and young adults. That is, from the birth till 19 years of age. So it involves preventive, promotive, curative and rehabilitative care of the children during hospital stay. Moving on to the very first topic, that is evolution and trends in child health nursing. Historical perspectives. Historically, children were often seen as miniature adults and their unique health needs were largely unrecognized. Child mortality rates were extremely high due to infectious disease, poor sanitation and lack of specialized care. Early care was often provided by families, traditional healers or general practitioners with little specific knowledge of childhood disease. The establishment of the first dedicated children's hospital in Paris marked a turning point, recognizing children as a distinct patient population. Pioneers like Abraham Jacobi, often called as the father of American pediatrics, championed in the specialized study and care of children in the 19th century. In India, traditional system like Ayurveda had ancient roots, but modern pediatric nursing evolved with the advent of the Western medicine and public health initiatives. Moving on to the next topic, that is trends in modern child health nursing, which is very important. First one, shift from illness to wellness. Focus has moved from just treating sick children to promoting health, preventing diseases, and ensuring optimal growth and development. Second one, family-centered care. This is a paramount principle. It recognizes the family as the constant in child's life and involves them actively in all aspects of child's care, respecting their values and cultural beliefs. It emphasizes partnership, collaboration, and shared decision making. Third one, community-based care. Increased emphasis on providing care in child's home, school, and community setting to prevent hospitalization and promote holistic well-being. This includes school health programs, home visit, and early intervention services. Fourth one, technological advancements. Advances in medical technology, example, in neonatal intensive care units, pediatric intensive care units, allow for the survival of the sicker and more premature infants. Nurses need to adapt at managing complex equipments. Fifth one, evidence-based practice. Nursing care is increasingly based on the best available research evidence to ensure effective and safe intervention. Sixth one, ethical consideration. Growing awareness of ethical dilemmas in pediatric care, example, informed consent, end-of-life care for children, decision making when parents disagree with the medical advice. Seventh one, increased focus on mental health. Recognition of the growing mental health needs of children and adolescents, with nurses playing a role in early identification and support. Eighth one, child advocacy. Nurses are increasingly taking on roles as advocates for children's rights, safety, and access to quality health care. Ninth one, telehealthing or digital health. Especially post-pandemic, remote consultations and monitoring are becoming more common, expanding access to care. Moving on to the next topic, that is principles of child health nursing. Children are not miniature adults. This is the most crucial principle. Their anatomy, physiology, psychological response to illness, medication metabolism, and communication abilities are distinct. Doses calculations, assessment techniques, and communication strategies must be age appropriate. Next, child centered care. The child's needs, comfort, and preferences are at the forefront of all the care decisions. This involves listening to the child, even if non verbally, providing age appropriate explanations, and involving them in the decisions where possible. Next, family centered care. Key elements include respect for the child and family, recognition and honoring cultural diversity, sharing complete and unbiased information, encouraging participation in care and decision making, providing emotional and practical support. Next, growth and development focus. Every nursing intervention must consider the child's current developmental stage. Nurses need to understand typical milestones to identify deviations and tailor care to support and healthy development. Next, safety and injury prevention. Children are vulnerable. A core principle is to ensure a safe environment and educate parents or caregiver on injury prevention. Example, falls, poisoning, burns, or road safety, etc. Next, play as a therapeutic modality. Play is an essential for the child's development and a powerful tool in nursing. It can be used for assessment, education, distraction during painful procedures, and emotional expression. Next, health promotion and disease prevention. Proactive measures are key, including immunization, nutritional counseling, hygiene education, and screening programs. Next, ethical practice and advocacy. Upholding the child's rights, maintaining confidentiality, obtaining informed consent from parents or guardians, and advocating for the child's best interest. Next, therapeutic communication. Adopting communication style based on the child's age and cognitive level, using play, drawing, and simple language. Also effective communication with parents. Moving on to the next topic, that is national health programs related to child health. Understanding these programs is vital for nurses practicing in India, as they form the backbone of public health efforts for children. First one, Universal Immunization Program. One of the largest public health programs globally, aims to vaccinate all children against 12 vaccine preventable diseases. Nurses are crucial in vaccine administration, cold chain management, and community awareness, which will be discussed in later on videos. Next, Integrated Child Developmental Services. A flagship program providing a package of services to children, that is 0 to 6 years, and pregnant lactating mothers, including supplementary nutrition, immunization, health checkups, referral services, preschool non-formal education, nutrition and health education. Nurses often collaborate with Anganwadi workers of ICDS. Next, Janana Sishu Suraksha Karyakram aims to eliminate out-of-pocket expenses for pregnant women and sick neonates accessing public health facilities. Focus on free delivery, including C-section, free drug, diagnosis, and transport. Next, Rashtriya Bal Swasthya Karyakram, a child health screening and early intervention program that focuses on mainly 4 Ds. That is, first one, defect at the birth, that is congenital anomalies. Second one, deficiencies like nutritional deficiencies. Third one, diseases like common childhood diseases. Next, developmental delays including disabilities. In this, they identify and manage developmental issues. Next program, National Rural Health Mission. While border, a significant component focuses on strengthening maternal and child health services, improving infrastructure, and increasing human resources in rural areas. Next, Newborn Care Action Plan focuses on improving care at birth and during the first month of life to reduce neonatal mortality. Includes initiatives like facility based newborn care and home based newborn care. Some other national health programs like Reproductive and Child Health Program, Maternal and Child Health Program, Integrated Management of Neonates and Childhood Illness, Midday Meal Program, National Vitamin A Prophylaxis Program, National Iodine Deficiency Disorder Program, and other agencies like agencies related to welfare services to children, that is, UNICEF, WHO, and NGOs working for child welfare in India. Moving on to the next topic, that is, Rights of Child. UN Convention on the Rights of the Child. It is an international human rights that is the set of civil, political, economic, social, health, and cultural rights of children. The key rights include right to survival and development, right to protection from abuse, neglect, and exploitation, right to participate in decision affecting their life, right to education, play, and recreation, and right to health and medical care. Next topic, national laws and policies in India. First one, protection of children from sexual offense, that is POCSO Act. Next, Juvenile Justice Act, that is Care and Protection of Children Act. Next, laws against child marriage and child labor. Moving on to the next topic, that is role of pediatric nurse, which is very important. A pediatric nurse can be a caregiver, educator, advocate, communicator, counselor, manager, researcher, rehabilitator, and many more, which will be discussed briefly below. So, first one, a nurse as a caregiver. Caregiver or providing of direct care, administering medications, performing assessment, carrying out procedure, and providing comfort for the child. Next, pediatric nurse as an educator. Educating children age appropriately and families about health condition, treatments, preventive measures, nutrition, safety, etc. Next, nurse as an advocate. Protecting the child's right, speaking up for their best interest, ensuring their needs are completely met. Next, pediatric nurse as a counselor. Providing emotional support to the child and families, helping them cope up with illness, hospitalization, or even loss. Next, pediatric nurse as communicator. Facilitating effective communication between the child, family, and healthcare team. Next, nurse as collaborator. Working effectively with other healthcare professionals like doctors, social workers, therapists, dietitians to provide holistic care, that is complete care for the child. Next, nurse as a researcher. Participating in or utilizing research to improve pediatric nursing practice, that is evidence-based practice. Next, nurse as a manager. Manager or coordinator. Managing caseloads, coordinating care, delegating tasks appropriately. Next, nurse as a rehabilitator. helping children recovery from illness or injury and adapt to chronic conditions. This chapter establishes the why and what of pediatric nursing, setting the stage for the more detailed study of growth and development and specific conditions. It emphasizes that caring for children is a specialized, holistic, and family centered endeavor deeply rooted in advocacy. Thank you. If you need more videos related to pediatric nursing, kindly like, share, and subscribe. Thank you.